On our morning show today from WRCO, we're pleased to have back in the studio with us Dr. Madeline Oie, who is the head pharmacist with the Richland Hospital and Clinics. Here to talk about pharmacies, and December is pharmacy time, a pharmacy month, and kind of a good time to look ahead at the new year and maybe making some changes, for instance. But good to see you again there, Madeline.
Yeah, it's good to see you. It's been a while, but I'm happy to be back.
The last time you were in the studios, you'd been on the job like a whopping 2 days, right?
Yeah, it was my second day, and we came out here to speak about Pharmacy Week.
Uh-huh. And you're back here to talk about some end-of-the-year times. It is an important time, I think, to talk about and think about pharmacies, isn't it?
Yeah, I think so, especially it's just being kind of the cold and flu season. It's hitting us right now.
Yeah, are we? I mean, I haven't heard any numbers, but are we starting to see some of that rise?
Yeah, December is kind of prime time for all those viral respiratory illnesses to spread.
And flu shots. I know that we just had something in the news today about it potentially being quite a rough season. What have you heard about that?
You know, I've seen a couple cases of patients that test positive for the flu, but shots-wise, they're kind of winding down. Most people get them a little bit earlier in the season, more like October and November.
But there's still time, right?
There's still time, yes.
Awesome. Well, tell us a little bit about yourself, if you would.
Sure. So I was born in Madison. My parents met in Madison. However, I have family out in this region. So I currently have family members in Boscobel, Muscadet, Blue River, even Richland Center. I didn't expect to end up here myself, but I definitely am happy that I did. And that kind of happened through my schooling. So I went to high school in Monona, and then I went to UW-Madison for college. I have an undergraduate degree in pharmaceutical sciences and then my doctor of pharmacy. And like a lot of college kids, I really had the travel bug. I wanted to get out there and see different places. So I did an abroad program where I went to a bunch of different countries. I lived on a cruise ship for 5 months and did some exploring in Japan, China, Vietnam, and I was taking classes that were either sociology of health and medicine or public health classes, and I got to see health and from a lot of different perspectives. Like I worked in a traditional medicine clinic in India, a HIV government-run clinic in South Africa, the Tama General Hospital, and then I found myself in Alaska through a 6-week rotation for pharmacy school, and that's actually where I met my husband, who is from here. So long story short, after a lot of exploring, I ended up in a small town, but I'm here to stay. I feel like I got the travel bug out of me. I had a lot of wonderful experiences, and now I'm kind of ready to settle down.
And you recently got married, too.
Yes, we did. Just recently got married.
Congratulations.
Thank you.
Sure. Had you ever heard of Richland Center when you were growing up in Madison? And you said you had family in the area.
Yeah, I had family. So I actually had a family member out at Pine Valley. So I'd been here to and from, just kind of passing through.
Okay. So as you were growing up, was pharmacy something you wanted to get into, or when did you get that light bulb moment?
I actually decided I was going to be a pharmacist at age 12.
You're kidding.
Which is crazy. It sounds crazy, but we do like an aptitude test in school where you kind of do an interest inventory and they match that with your test scores, and they give you this like pie diagram of what careers you could be fitted to, and mine came back as pharmacist at that age, and we had to do a follow-up school project on it. So in middle school I had to present to my class about being a pharmacist, what job opportunities look like, what the salary was, all of the kind of logistics of it. And as I did that project, I'm like, this doesn't sound half bad. And that's been the plan ever since.
So you tested well probably in what, science and math? And
yes, chemistry, calculus, all those STEM classes.
You must have to have a pretty good memory, don't you?
Yes, you do. And I feel like I am lucky. I do have a decent memory. Sometimes I see a patient walk into the pharmacy and I can see their med list in my head.
That's crazy. Now, overseas, when you're studying over there, you talked about working in the different locations there. In English, or are the prescriptions and things like that in English, or how do you see it?
No.
So how do you translate that?
So I was working alongside. I had a preceptor or like a lead pharmacist that I was working right next to the whole time. So they were kind of doing translation. It was a lot of shadowing, just kind of learning what's going on in different parts of the world.
I'm guessing there's probably an app,
Yes.
on your phone where you could convert it to English if you need to, right?
Yes, and we actually use an iPad at the hospital too. We have lots of patients that speak different languages. We have Spanish-speaking patients, so those apps are super nice. And we actually have ones where we have like a live interpreter. So there's a human on the iPad that is translating between us, which is amazing.
Oh, okay. That's got to be really helpful, doesn't it?
Yes,
Yeah.
yes.
What about you have to be a handwriting expert too to decipher some of the doctor's writing too, right?
That's kind of like the doctor's handwriting is now becoming like an old wives' tale because everything's electronic. Everything's on the computer. From time to time, I'll get a written script, but it's pretty rare.
Yeah, I guess that probably is old school, unless they're writing with their finger on the screen or something. Then it's a little bit. Anyway, so you've been open about a year, the community pharmacy at the Richland Hospital. And how's the first year been?
It's been great. I feel very, very lucky. I'm very grateful. I work alongside two excellent pharmacy technicians, and we make a good team, the three of us down there. And this past year, we've kind of focused on building up our inventory, kind of figuring out our workflows, developing policies and procedures, all of that business. But more importantly is just getting to know our patients and meeting people. So we've done some fun little things over the past year, like raffles and giveaways, just to welcome people in the door. I think it's a goal of mine and a priority of ours to really get to know our patients, not just their name and what medications they're on, but who they are, what their needs are, how we can serve them best.
You've come a long way in a year. Do you have goals for 2026 and some things or changes you'd like to see, Madeline?
We do. I mean, the pharmacy's growing for sure volume-wise. So the number of prescriptions we do per day is growing. The number of vaccines we've been doing is growing. And then the involvement I've had in different areas of the hospital has grown as well, working alongside some of our nurses in the chronic care management program. We've got some other programs that are kind of in the works too that I won't talk about too much quite yet, where I'm getting involved in. So there's a lot of growth there for sure. We want to continue to do our compliance packaging. There's opportunities for growth there, lots of opportunities for just more individual patient counseling, kind of having one-on-one medication therapy management meetings. There's a lot of opportunities in pharmacy, so there's a lot of ways we could go.
Very important to have that talk with the patient, though, because to explain what they're taking and why they're taking it and what it's supposed to do, right?
Yes. So I answer a lot of questions, which I love because I love being able to share what I learned in a long 8-year stretch of schooling with folks. But we get to talk about what their medications do in their body, how they work if they're interested, but also the best way to use their medication. So this could be morning versus evening, food, without food. I get a lot of questions about possible side effects, what things might go away over time versus what things need to be brought to the physician's attention. I get questions about adherence or compliance, which just means how well we remember to take our medications. So working with patients on strategies of let's set an alarm on our phone. Let's set up a pill box. How can we make this fit into your lifestyle and your schedule? So I'm fielding questions all day over in the pharmacy, but I love it.
You have to know what would counteract with another medication that somebody might be taking and that effect. I don't know how you do it and keep it all straight.
That is correct. So we spend a lot of time in school learning about metabolism of drugs. So your liver has different enzymes that metabolize drugs, and sometimes one drug may speed up an enzyme or slow down an enzyme, and then that affects how a different drug is metabolized. But there also is databases and reliable sources on the internet to run checks as well. So we have aids and resources to help us.
What are the hours at the Richland Hospital Clinics community pharmacy?
Right now we're open from 9 to 5, and we do have a short lunch break from 1 to 1:45. Hopefully in the future we can expand that, but that's what it's looking like for right now.
December, an important time to head to the pharmacy, isn't it?
Yeah, I would say so. because of that cold and flu season, I've got a lot of people that are coming to just stock up on their supportive care measures. So what I mean by that is like your fever reducers, maybe your cough drops, just things to make you more comfortable while the viruses are passing on through. And then we also have people coming into the pharmacy a bit in December or just towards the end of the year because folks are trying to spend up their flex dollars before the end of the plan year.
Yeah, talk about flex dollars and what they are.
Sure. So the flex spending program is a pre-tax benefit that a lot of employers offer. And what it is money that's set aside to use on eligible healthcare spending. So that's your copays. So copays for appointments, copays for prescriptions, but then also OTC products are often eligible as well. And if the money in that account isn't spent by the end of the plan year, it is forfeited. So we like to educate our patients on that just so they can use that opportunity to stock up on anything that they might need.
How do you know if something is covered by flex dollars?
So at the community pharmacy, we actually have the word flex on the tags in our OTC section. But if there's ever like a question or confusion, you can always just ask one of my team members or my staff members because we are able to look it up on our end. And if there's any products that you might need that you don't see on the shelf, we can often order things in as well. So you can always ask us if you're not finding what you need.
And what about good ways to spend those down? I mean,
Yeah, I don't think there's a good like blanket recommendation for everyone because healthcare is so individualized. Like I do think it's so important to treat each patient as an individual. But if there are things that you use often, you can kind of take inventory of your medicine cabinet and things that you're almost out of or things that are expiring. It's just an opportunity to stock up on those things.
With prescriptions, you can't necessarily do that because a lot of times you can only get so many pills in a certain amount of time.
Yeah,
right?
Unfortunately, the insurance controls quite a bit there. That makes my job harder sometimes, but there's often quantity limits of how much you can get, or we'll get a rejection that says too soon, so my hands get tied there.
Let's talk about that a little bit because I think sometimes the pharmacies bear the brunt when I walk in and I find out how much a certain thing costs.
Yes.
That's out of your control too, isn't it?
Yes, and I often am the middleman, which is a role I try to do my best to navigate because I understand that it is frustrating. I understand that drug costs have gone up. I understand that sometimes you want a full 90-day supply just because making it into the pharmacy is a trek for you. We have people who live out in the country. So I feel that frustration for my patients. Like I can see why they're frustrated. And I try my best to have empathy, but then at the same time, I'm kind of tied by the rules of the insurance companies. We have contracts. So whatever the claim tells me the cost is the cost that I have to charge.
And that changes too. I think that's what frustrates people.
It does.
All of a sudden, you kind of budget, and then all of a sudden, it's out of sight.
I know it's frustrating, and I wish that I could give thorough explanations. But honestly, it's all behind the scenes, and we don't have a course in pharmacy school that teaches us about how the insurance companies operate and how those decisions are made. And so it's all a mystery to me as well. So I wish I could give more answers for that.
Mm-hmm. Now, you've been to other countries, as you said. Obviously, their healthcare things are entirely different. But are there some things that you've seen that you'd like to see utilized in our country, perhaps?
So different. I think when I was in South Africa, for instance, the accessibility of HIV medications were so stigmatized that they had patients who would avoid going into a healthcare system. So they would avoid going to a pharmacy or a clinic. So they actually had vending machines just out in the public with antiretroviral medications that were funded by the government that folks could pick up from a vending machine just because of the stigma. So definitely hard to compare those other countries and experiences to Richland Center just because it was so vastly different.
Mm-hmm. No, I see. But it certainly is something that, I know that you do have the chance to maybe shop around a little bit for people and try to get the best deal if you can then.
Yes, we do for sure. We always look at, from our wholesaler, we try to purchase drugs that are the most affordable. We try to guide patients to OTCs that are lowest costs. I'll even talk to patients if they have questions about their insurance plan. I can help them, direct them to cms.gov and look at different options. I do the best that I can for sure.
Generic brands and name brands, is there a huge difference?
So it's the same active ingredient. It's just you've got a name brand that's marketed differently. But again, insurance can tie my hands there because based on their formulary, they can prefer one over the other, which dictates what I can dispense.
I'm watching TV and I see these ads on there, and they talk about the particular drug for about 15 seconds, and then 45 seconds, it's all of the side effect possibilities.
Yeah.
That's a little scary sometimes.
Yeah, those are funny. It's funny, too, being a pharmacist, being like, what are we doing here? And oftentimes, too, the drugs that are advertised heavily are our newer products. And oftentimes, it's our newer products that are not on insurance formularies. So you can always ask your doctor. I always encourage patients to have open conversations with their doctors because patients are involved in their healthcare decisions as well. So if they saw something on TV and they want to discuss it, I encourage it. The trouble there, again, I feel like I'm just blaming insurance for everything in this interview, but a lot of times those new drugs that are advertised are not going to be covered by their insurance quite yet.
I see. Yeah. So what happens? Do they have to be they have to prove themselves, so to speak, before they get accepted, or? They
have to become less expensive. There's just patents and trademarks that take some time to time out.
Okay. What about over-the-counter things? Because this time of year, as you mentioned, it's a good time to get stocked up on a few things here and there, cold medicines and things like that.
Yeah. I encourage people to come on in, and I would love to speak with you because, like I was kind of touching on earlier, everyone is so different. So depending on what your symptoms are, what you're struggling with, what other chronic health conditions you have, what other prescription medications you're on, all these things factor into what the best product might be for you. And it can be really confusing to navigate the cold and flu aisle because they market those things with the word cold or flu right big on the front of the box. But what actually matters is the active ingredients. So that's what I look at, and that's what I can help folks navigate.
I know that I'm a big one with things, and it's probably a placebo, but there's some zinc things and things like that. Like if you feel a cold coming on, you take this and it supposedly thwarts it. Is that a placebo in my head, or does that actually happen?
Well, I think it kind of depends on your baseline levels with all those vitamins and supplements. If you're running low on something, supplementing might give you that extra boost you need. But to be quite honest, my schooling did not touch heavily on vitamins, herbals, or supplements. We focused more on drugs, which are a different category per the FDA. But this is something that I think is worth some of my continuing education on. And I know we have providers at the hospital that did have more specialized schooling towards our supplements and more holistic style of medicine. So I am not the expert quite yet, but it is something that I want to continue learning about for sure.
Wash your hands, right?
Oh, yes, please.
This time of year?
Yes. When it comes to preventing our different viruses that are going around, preventing transmission, I would say is the most important. So what that looks like is washing your hands, good hygiene in general, and then just being aware of your surroundings and trying not to expose yourself to folks that you know are already sick.
Mm-hmm. 6 feet apart, as we learned a few years ago. Right?
That was the rule then, yeah.
So keep that in mind. As far as we talked about being at the hospital there, how does it work then if somebody is being discharged or whatever? Do they go through you, or how do they go about getting their prescription filled then?
Sure. So patients, when they're filling an outpatient medication, they have complete autonomy and choice of where they want to get their medications filled. So both the inpatient, so if you're hospitalized, you're staying with us for a week, the doctors are sending you home with some new prescriptions, you get to choose if you're going to fill with us downstairs or another local pharmacy in town. Same with our clinic patients. If you get seen just by your PCP and they're changing a dose, you can pick it up from me. You could also pick it up from any of the other local pharmacies. It's completely patient-driven.
I know that we had some guests on from the hospital not too long ago, Madeline, and they're talking about the eye clinic, and that's something down the road.
Oh.
But certainly that's something that is something to look forward to. You do deal in some contact lenses and things like that too as well, don't you? Or,
well, I've got a handful of prescription eye drops.
Oh, I see.
But then we do have just the over-the-counter contact supplies, which are actually flex eligible as well. So if you need contact solution, things like that, we've got those for you.
Okay. What are some other examples of flex eligible? I don't know if we talked about all of that.
Yeah, so it's your medications for the most part. So we've got fever reducers and pain relievers. You got your GI medications like Tums or Miralax, fiber supplements, a lot of the cough and cold. But then there's some more untraditional things as well, like your like the contact solution, pregnancy and ovulation tests. Our bigger items like blood pressure meters or blood glucose test kits, pulse ox readers. Those are all flex eligible as well.
My acne medication, is that?
We carry some different acne washes and preventative things, and those should be flex eligible too.
Something I needed, a few years ago, probably.
Oh, yeah.
So in terms of looking ahead then to 2026, it's a good time to kind of look at your plans, and I'm guessing somebody stops by, you give them some advice and some things to look forward to, right?
Yeah, so I can point them to CMS.gov or Medicare.gov, where it's actually really nice. I've used it and helped navigate some of our providers with it, because you go in and you enter your zip code, and then you can enter the drugs that you're taking at what doses, and then you can select all the pharmacies in the region, and you can kind of see what plans are contracted with what pharmacies. So if you're trying to stick with a certain place, you can use that tool. So what I usually do is I can print that report for patients or just navigate them to that, so they're making an educated decision on whatever they choose.
I think that time is closed for the marketplace, right? And those things?
I think so. Open enrollment, I believe, just ended here.
Yeah, I think it did as well.
Yeah.
Yeah. But it's certainly if somebody changes jobs or whatever, I mean, you can kind of direct them in the right direction there as well, too.
Yeah, I welcome all questions. So call me, stop on in.
Talk about your staff as well. Who do you work with? What are some other names there?
Sure. So I have two amazing technicians. I have Therese and I have Julie, and they're both experienced in healthcare pharmacies to different degrees, and they have been amazing partners. I get to work alongside them every day. They kind of pick up the slack when I get busy. They're always fielding phone calls or triaging things for me. They're prepping the meds. They're doing a lot of the inventory work. They do just maintenance of the pharmacy, just keeping up with the even just the trash and making sure we have bottles and bags available. They do so many things behind the scenes that people don't know even need to happen.
If you take quite a few, those day of the week plastic containers are pretty helpful, aren't they?
Oh, yes. So we actually have some of those that are free if you want to stop by and grab them. We had them from our grand opening last year, and we've got some left still. So we always offer those to patients because they are definitely helpful, at least keeping you accountable to take your med every day, and then it shows you if you wake up the next morning and those Tuesday pills are still there.
Anything else you want to add today, Madeline?
Did
we cover everything you wanted to cover today?
I think we did. Okay. I appreciate your time.
No problem. I'm just so impressed by what a pharmacist knows and has to know and that kind of thing. Did you ever have any thought of being a physician, becoming a doctor of medicine?
I did for a little bit there, but I'm happy where I'm at. I truly am.
Okay, great. Well, nice to see you again. And after a year, it seems like it's going really well for you. So.
It is. Thank you so much.
Yeah, thanks for coming in. Dr. Madeline Oie, who is the head pharmacist with the Richland Hospital and Clinics. They're at the community pharmacy. We'll have more coming up on today's morning show.